Hello, my name is Roxana, and I am glad to have the opportunity to present some work I've been doing for these past few months to propose a program to tackle cervical cancer among Hispanic women in Dallas, Texas. So what is cervical cancer? Cervical cancer is a chronic disease in which the cells of the cervix multiply and grow abnormally, ultimately transforming into cancer cells. It is known as the fourth most common cancer in the world. It ranks as one of the top gynecological cancers. It can also develop with the infection of the human papilloma virus, HPV, which is a very common sexually transmitted infection. Then having it persistently can lead to the development of the cancer. Hispanic women have a high rate of developing cancer and the second highest rate of mortality from disease. Hispanic women are less likely to be screened compared to non-Hispanic women, mostly due to the language barrier, cultural barriers, and educational barriers to access services and information. So looking at this graph, we have cervical cancer rates in the US per 100,000. Hispanic and Latinos are at top. And then we have the graph for the state of Texas. Same ethnicities found. And as you can tell, Hispanics are still at top. And then we have the graph with Dallas County, where Hispanic is still at the highest ranking with cervical cancer per every 100,000 women. By these three graphs, Hispanic is the top race or ethnicity to keep an eye on in development of cervical cancer. Cervical cancer can influence the health and well-being of women who have been diagnosed or treated through some type of treatment or surgery. Women can develop anxiety and depression. This group is vulnerable to developing these conditions because it is a diagnosis that can be scary, it can be overwhelming, sometimes very hard to understand what is next and how it can affect their life. Sexual health is an important aspect of life. It is linked to thoughts, feelings, actions, social integration, and physical health. In a study done with 30 participants who were cervical cancer survivors, the women reported sexual inactivity and dysfunctions. Other things like loss of libido, vagina dryness, inactivity, um, vagina dryness, and pain during intercourse. In multiple studies, there were reviewed, women who were treated with radiotherapy or radical hysterectomy experienced things like reduced intercourse, dissatisfaction with sexual life, and loss of sexual interest. Fertility is also affected by cervical cancer, especially in women in the childbearing ages. Treatments like hysterectomy, which is a removal of the uterus, radiation therapy, which can damage ovaries and the ability for them to function, chemotherapy, which can damage reproductive organs. There was a study done, 50% of women get fertility sparing surgery, which is a surgical approach that aims to preserve their ability to conceive in the future. And then we have the factors that contribute to cervical cancer. So individual factors, an example would be being sexually active at a young age can cause the individuals to come in contact with HPV and or having multiple sexual partners. Examples of socioeconomic factors would be women in low incomes or families with low income who do not have easy access to healthcare or for screening, HPV tests, or HPV vaccines. There was a study where patients were diagnosed with cervical cancer, and they were more likely to live in neighborhoods with the highest percentage of those who did not graduate from high school at 59.8% compared to non-Hispanic whites at 18.6% and non-Hispanic blacks at 42.3%. And then we have those cultural social beliefs that can contribute to human behavior. Women can get scared of undressing for healthcare workers to get screened, or they just rely on traditional medicine. And then sometimes even the men do not know or are not aware of the benefits of screening. And then some do not allow their wives or their daughters to receive the screening needed. And then we have environmental factors like pollution. When someone smokes, they are exposing themselves and others around, and then they are inhaling cancer-causing chemicals into their body. So those who smoke, women who smoke, are twice as likely to get cervical cancer, and their immune system becomes less effective and are also prone to getting the HPV virus. And then why the organization of Supervive. Supervive, which is was previously known as Los Angeles, is located in Dallas County. It is a nonprofit to help target the Hispanic community, but specifically women, to give them health and well-being education for them and their families by creating positive health communities and leading women to live healthier lives and reduce the incidence of chronic disease. It started off as a digital blog in 2014, then became a nonprofit in 2016, and by 2022, it's two major programs implemented with amazing success. For 2024, the programs from Supervive have made meaningful impacts with participants maintaining and improving aspects of their well-being and health work. For example, 90% of participants felt a strong sense of connection and support within the wellness community, and 96% felt empowered to take charge of their health. Right here, I have links that are hyperlinked to the impact report for the organization and also the website URL. And then there have been evidence-based programs that have been implemented that have helped women become more educated and get the screening they need. So the first one is De Casa en Casa. The main purpose is to educate women on cervical cancer and screening, which includes outreach, navigation, provision of no-cost screening, and diagnostic tests through the support of grants. The education classes were done with the help of flip charts, testimonials, body diagrams, and a local source handout and informational brochures. The intervention reached its purpose because there was a 66.8% of cervical cancer screening completed. And then we have the video-based education intervention, abbreviated as VBEI. The aim was to assess the impact of video-based education intervention in promoting HPV vaccination, cervical cancer awareness, and willingness to have a pap smear. At the beginning, only 84.2% had some knowledge about cervical cancer, and after 100% became aware of the information. Here, I have decided to use the health belief model. The health belief model is known as one of the oldest individual behavior theories used in public health and widely used. For the program proposal, the main idea behind it is to change the Hispanic woman's thoughts on going to get screened and be more educated on the topic of cervical cancer. This model has been developed within several health issues, has helped with the implementation of many programs regarding many different health issues by having patients adhere to medical treatments, prevention behaviors, and participate in those medical health screenings. Using the theory will help implement the program being designed and help in the yearly pap smear screenings for those women who cannot receive them and young girls who have not received their HPV vaccines. And then we have the program proposal overview. So it is targeting two objectives from the Healthy People 2030. So Healthy People 2030 is basically the framework that encompasses the central ideas and functions of Healthy People 2030. And so the two objectives that we are targeting in Healthy People 2030 is the increase in the proportion of females who get screened for cervical cancer, the increase the proportion of adolescents who get recommended doses for the HPV vaccine. The proposed cervical cancer program targeting Hispanic women will have factors that will focus on information regarding cervical cancer screening and HPV vaccination, addressing various factors such as financial, social norms, and language barriers, education on what HPV and cervical cancer is, and improving the communication with the healthcare system on the topic with funding for access to services. The program goal is to prevent and reduce cervical cancer by educating the community, specifically the Hispanic community, through education, collaborations, and by addressing health disparities. The program will occur every year during the month of January, which is known as Cervical Cancer Awareness Month. There's a pre-survey that will be done when the people join our program. The pre-survey would include questions like language proficiency, educational level, income level, past screenings, and then they will be receiving a 6-month post-test around June, distributed to each of the participants to ask about their knowledge and if they have done anything different, for example, getting a pap smear or getting HPV vaccine. The following interventions that will be implemented would be education video-based classes, cervical cancer informational workshops, yearly cervical cancer screening drive, and the HPV awareness and vaccinations drive. The pre-surveys will help decide if people just need to come to a couple interventions or they can even participate in all the interventions. For the video-based classes, we will have the community health workers to educate participants on cervical cancer and HPV. There'll be a total of 4 video-based classes to work out for the participant schedules. 2 would be morning times and other 2 would be evenings. The cervical cancer information workshops will feature guest speakers, testimonials, and providers, group and individual activities, handouts, brochures, and other resources for women who need information and need assistance with cervical cancer information and screening. There will be 2 scheduled workshops, one at the beginning of the month, which will happen on weekends, and one at the end of the month, which will also happen on a weekend and just a half-day event. The yearly cervical cancer screening will be funded by grants and fundraising through our partnered organization to provide screening for women each year that need it due to low income and no health insurance. The HPV awareness and vaccination drive will also be available for those young girls who have not received their HPV vaccines throughout January. And we'll also have a resource materials kit with information about HPV and how one can develop, how it can be developed, and what to avoid. Both the screenings and vaccination would take place on Saturdays, 2 different Saturdays, at possible health fairs in the community area. Then in 6 months, each participant will receive that email or that text or mailed post survey to evaluate if their behaviors and knowledge have changed since the program activities. And then here we have the logic model. It is a structure that connects what is planned to do with its expected outcomes and impacts. This model helps understand and see what outcomes can come from the interventions, the ones we talked about. The logic model summarizes the program of what can expect from the participants. It has the inputs of those who involved, the activities, interventions that were listed, and then also list of different categorized outcomes that should occur from our Hispanic women participants. And then we have the evaluation plan. Evaluation is a big part of the theory implementing. Evaluation is the process that consists in making sure the goal purpose of the program can be targeted, determine whether the program has the effective based on the goal purpose, assess if the program model and theory used were useful, and sometimes assessing the cost effectiveness and understanding the issues. And then here we have the questions that are broken down for the evaluation process. We have the process questions, the impact questions, and the summative questions. And so this is basically the end to just sum it all up. Cervical cancer among Hispanic women in Dallas County and in Texas are at very high rates. This program proposal will give the chance to target increasing knowledge on cervical cancer and HPV and increase the rates of screening and receiving the vaccine in Hispanic women in the community. And the collab will be with the nonprofit Supervive. Thank you so much for taking your time and seeing this information on the program proposal. If you have any questions, please feel free to contact me through email at my TAMUC email. Thank you.